Hello, hello. Today we're going to talk about the best place to start your career if you are an aspiring dermatology nurse practitioner. Welcome. My name is Dr. Kimberly Madison, and I use social media to share my journey. I'm a nurse practitioner entrepreneur that specializes in dermatology nursing education and research. I've been going live every week for over a year on YouTube, and I drop free articles every week on the Mahogany Dermatology blog for the last 2 years. I've used these last 2 years to share my journey. So you can certainly check out both platforms to hear about my humble beginnings from not only being a nurse, but going through the BSN to DNP program. I don't really talk about my travel experience that much there, or even the transition in life after travel. But certainly, most of the questions that you have, you'll find that I've answered them in terms of practice, social media, and even most recently on starting a business. Today, as you can see, we'll talk about the popular question on where you should start. Um, like many of you, I was a nurse practitioner looking to get my first job in dermatology, only to find out that even though I had over 10 years of experience and all the education that they offer in nursing, that I wasn't a candidate. Now, it's true you can get a job, and people have gotten jobs without experience as nurse practitioners, but by and large, they are looking for 2 years of experience, both not only in derm, heavy emphasis on the derm, but also as a provider. And, coming out of school, we just don't have that. And because the traditional path most nurses take is through the hospital or the acute care setting, even still, we don't get a lot of exposure to derm in school or through our training. At the most, we get taught about the integumentary system, how to prevent pressure ulcers, and really the lack of diversity in dermatology education is significant when it comes to skin of color. And so when we're applying for those jobs, we're not a competitive candidate. And so in realizing that, I thought, well, man, I should have been getting my experience when I was still working as a nurse. And so much of my time and the resources that I've created for you in the virtual preceptor shop are about helping you make that transition from bedside to dermatology. So that you can be a competitive candidate at the time of application, because you're competing with PAs who typically, not all of them, follow a medical model that dermatologists who are typically hiring are familiar with. And then more so than nurses, they will get some exposure to derm. Not all of them, they've told me. But there are a lot of things that are more familiar to physicians when it comes to PA training. And so traditionally, PAs have outpaced us. And so today we're going to focus on where I think you should start. The old age question, right? So, like I said, we come on here every week. So this is a continued conversation. We've talked about how to get your first job in dermatology multiple times on this platform, more so here than the blog. The blog is a resources to help you with your practice, everything from building inclusive care environments, contract negotiations, essential dermatology textbooks for skin of color, emphasis on aesthetic training. Conference reviews. I did a whole play-by-play on the conference at Elevate Derm in Boston. I've covered so many things, different organizations, resources that are available to you. So lots of information, and most of it based on your questions. And so we'll get into our topic. We always do a devotional too at the beginning. At the time that you're watching this, let's do our devotional first, because I'll lose focus. I was gonna say something else too. Well, I don't know if it'll come back to me. But anyway, let's do our devotional today. So yeah, every week we talk about our main topic, but we also go over health and wellness, because I believe that if you're in the business of caring for other people, then you should be in the business of caring for yourself. And so I typically will give updates on my physical, mental, spiritual, and physical, mental. I don't really talk about my emotional health that much, but I try to cover much areas that I'm comfortable with talking on social media. We'll talk more about finances this year, financial health. But the spirituality part is really important. So I don't have any updates in terms of physical health, because I'm batch contenting and I've already given you an update on everything. So we'll just jump into our devotional. I use the Holy Bible app. You can go to their plans and see a number of options there for you. And this one is 21 prayers every Christian should pray. And this one's called Lift Me. And the scripture that we'll read today will be coming from Psalms chapter 3, verses 3 through 4. If you want to get yours out while I read the devotional, then we can read together. Body language speaks volumes. Sometimes we can literally read what's happening in someone's heart by the way they posture themselves. And a common posture for someone who is feeling discouraged is to look down. It's like the weight of the world is on them. And they find it difficult to face life. With this in mind, the Bible says that God is the one who lifts up our heads. You see, when you're looking down, all you can see is what's down. It limits your perspective and lowers your expectations. When we look up, we can start seeing beyond our present circumstance. We gain perspective and we begin to believe for a better tomorrow. When we look up, we begin to see that God is at work even in our trials. So our prayer today is, Lord, help me to look up so I see what you're doing. And then your focus for the rest of the week is to lift your head and change your perspective. And you should ask God for help with that. So our scripture, but you, O Lord, Gunny, bring it. This is the third hour, so he's a little over it. But you, O Lord, are a shield around me. You are my glory, the one who holds my head high. I cried out to the Lord, and he answered me from his holy mountain. Amen. Okay, so now the baby's here. He likes to get on the walking pad. And he knows what to get. I'm just going to go get what he was messing with. Because he's going to rip it. And I already lost one of them. And I don't know where he put that one. Okay. He does that. He's not a fan of batch content. So I want to shout out my friend, Dr. Farah Laurent. I talked about her upcoming conference on my recent episode too. She's a good friend of the Melanin Initiative podcast. She's a nurse. She has her DNP degree in, I don't know, I can't remember if it was, I'm looking at her credentials. I think it was education. So yeah, she's been in academia before. Her bedside training was emergency medicine. She's from Canada. She has her own podcast called the Nursing Dose with Farah podcast. And she's an author of Nurses Making Money Moves. I need to put her link in the description box. And she's having her first conference, which is, I think it's called Nurses Making Money Moves. Yeah, Nurses Making Money Moves on Saturday, March 8th from 8 a.m. to 7 p.m. in Tampa Bay. Yeah, Tampa, Florida, at the Tampa Museum of Art. She's on LinkedIn every single day. She's a top LinkedIn voice. There's so much you can do on LinkedIn. I'm telling you guys, like you just get so much more for your buck over there in terms of like scholarly education, communication, and return on your investment, right? And you can just see the people that you follow and what they're doing, even if they don't, and people can see what you're doing, right? Because if you're going to make all this content and put it out there, you want people to see it. The people who follow you, so they want to see it. But if you're not on there, if you miss that window, you won't know unless you literally go to their page. But on LinkedIn, that never happens. You can be away for 5 days. You're still going to see their posts. And they're going to see your posts. So actually, by the time you're watching this, it's already too late because her early bird special ended at midnight on December 31st. But you can still sign up. You will get CEs. The keynote speaker is a lady by the name of Precious Williams. She's the CEO of Perfect Pitch. She is a 13 times national elevator pitch champion, 5 times #1 best-selling author, world-class speaker and trainer for global brands. She's been on Shark Tank, CNN, Wall Street Journal, Forbes, and Black Enterprise. She's being joined by Shanae Moret, who's a brand strategist, Renee Lindo, personal stylist, Teresa Sanderson, who's a consultant, Dr. Rebecca White, who is the James W. Walter Chair and Professor of Entrepreneurship. I can't wait to hear from her. Dr. Kiana Jones, she's the owner of the first Black med spa in her town. And Alice Benjamin, media expert and consultant. Not only did she talk about the importance of nurses being in media, being seen as voices and credible experts, but media trainings are super important. and Farah herself, who will be talking about branding. So uh, there's that. 2 weeks later, we'll be in Louisville, Kentucky for the Diversity in Dermatology Conference, where we're staying at the Marriott downtown. 4 days of content, including CEs. The Achieve Program reception. One of the nights will be at the Churchill Downs. And it's just a great time to to meet new people, to see old friends if you've been with us before. And it's just a great time. Shout out to Risha and Andrea, the co-founders of Diversity in Dermatology, who've been nothing but supportive of me, despite coming into the group with no experience in terms of dermatology. And even at that time, I wasn't even practicing. I wasn't even a practicing NP. I graduated in 2019, but if you follow my journey, I didn't start right away because I created my own path, made my own way. And that's what I recommended in the last video a little bit, is that when we make that transition, whether it's from grad school, from nursing, from bedside, from primary care to entrepreneurship, to anything, marriage, being a parent, take a break, right? You have so much momentum leading up to that you really want to just take a break and recalibrate, reset. And you can't do that if your foot is still on the gas. So let's talk about it, hospital or clinic. So like I said, and I've talked before, and I think I know in one of my other videos, I've said, just start there. And I don't think, long story short, both options have their pros and cons. So we've talked about if you start there, then obviously you're going to be competitive when you apply for that first job. Now, in the last couple of weeks, I've been hearing, and I said traditionally PAs have outpaced us in dermatology. And in some states, even here, I think in Texas, NPs seem to be a little bit more dominant in derm. However, the tides are changing, friends. I'm hearing and seeing from people in practice that NPs are starting to be a little bit more preferred. And I'm going to talk in this video about why I think that is. And because of that, my advice on where you should start is going to be influenced by that. So no one else in healthcare besides nurses is part of the spectrum. From the time the patient enters the system, wherever that may be, whatever setting, to, let's say, discharge, long-term care, home health, hospice, you name it, the nurse is central, the central theme and presence in every part of the patient care, all the way up leadership. You see nurses at every single level. We have the most trust. We have the most diversified skill set. Not only as NPs, right? We're diagnosing, we're treating, we're evaluating, we're doing education, right? The nurse is really doing a lot of education too. So they're intimately involved in all those phases. Because even as a provider, even though I explain all these things, we know, at least I know as a night nurse who witnessed many conversations with doctors talking to patients, who nodded yes, who said they had no questions, only to see the doctor leave and they have a bunch of questions for me. I know that the nurse is intimately involved still in that conversation. Even if they're not the ones initiating it or delivering the news, they're on the back end explaining it. Sometimes they're in the front end because the patient already has ideas, they've already talked to someone else, they've already looked things up, they already have a family history. So the nurse might be the first encounter or the secondary encounter to offer that clarification, build that trust. Yes, you should take this medication. This is how it works. This is what you can anticipate. This is what I've seen in other patients. This is the most common area that I address when I educate patients. So the nurse is intimately involved in delivering the information, delivering the care. I don't use my stethoscope anymore. I haven't used a catheter to poke anyone in over a year, right? But the nurse is actually the one administering that care. So that perspective, that skill set, all the expertise that comes with that, you only see in nurses. I have taught residents how to draw up medication in a syringe, so yeah, nurses have a lot to lend any team. And I think mostly we're seeing physicians hiring NPs. There are NPs hiring other NPs, right? But it makes sense that they would hire an NP because they already know. So really this conversation becomes more valuable when we talk about the physician business owner, right? Particularly of a clinic. they're the ones who are really starting to see things a little bit differently. Even in industry, there's a lot of companies that and still exist that only wanted to talk to the provider or the physician for decades. But now that they have a better understanding of how involved nurse practitioners and PAs are with patient care, now we've been invited to the table. And I have a sneaking suspicion, because of how intimately involved nurses are in clinical practice, home health, virtual nursing. Shout out to Alicia, our in-house virtual nurse expert, that you're going to see nurses being invited to those tables too. I have a sneaking suspicion, because we're the ones picking up the phone, because we're the ones providing that education, we're the ones coming in offering the treatment, right? Even in something as serious as chemo, the nurse is delivering that care. And so I think the value of what we bring to the table is that much more significant. We do invest in a lot of education. Everyone's always going back to get another certificate. In one way, it kind of slows you down as a business owner, because you think you have to do all these things before you can take your first step. But on the other hand, it does show how our commitment to excellence and care. So the business owner, right? Like I said, I talk to you guys every week about how busy business owners are, how little time you have. So when you're thinking about bringing someone onto your team, you need someone who can pretty much do all the things. Even if you're hiring them to do this X, Y, and Z, if it ever comes down to it, they could do it, right? Now, in derm specifically, MAs play a huge role, right? More than if you've only been in primary care, you're going to be shocked at how much MAs can really do. And as a business owner, that's your best friend, because they can do so many things at a pay rate that's more economical to your bottom line. And so when you're trying to make money, you're going to look to someone who has that level of that's in their scope. And so for the nurse, man, so we have to talk about strategy, right? So you do your education and training, you take your boards. I think that's the best time to start in the hospital, because you want to put all of that to practice, where you're going to build up that skill set, as opposed to having to come back and get it later. You really just want to take everything you know and capitalize on it. So yeah, and because that schedule is so sweet, especially if you do the 3 12 hours, it opens you up. You can do some PRN hours in a derm clinic. Now the question becomes, if you do want to go back to school at some point and get your NP, or even go to get your doctorate, then where are you going to work? And this is going to be different for everyone. Will it be more convenient for you to be in a hospital that has PRN hours that are basically available 24/7? Do you need that flexibility for you and your family? Can you get the PRN hours that you need at a derm clinic? Because let's say you do your 2 years, get your baseline experience as a nurse, right? Build up that, because even for yourself, not even outside of just derm, at some point in your life, you might change what you want to do. You might want to add on services. If you listen to the Elite MP podcast, so many people add on all these other services to their practice over time. If they have other interests, this will help you stand out in the market too, if you're looking to have your own clinic at some point, right? So those are some other skills you can bring to the table. Don't just think ICU. What in the ICU is going to help you in the derm? I would love to hear that. But there's other skills you can bring. Maybe you take a foreign language. Think about other services you can offer your peers, so that your customer can be your patient, can also be other providers, or even clinicians, maybe not even providers, people who want those skill sets. Because remember, the MA, the nurse, and the NP can deliver, let's say, for example, aesthetic treatments. So maybe when you're building your practice, you decide you're going to offer some training, and maybe you want to take some time and learn some business acumen. So if you start in the hospital, work 3 days a week, you can use the other days to do so many things. Now, I know there's NPs who work in derm clinics who might work, shout out to Dr. Joseph, 3 days a week. I know it's not uncommon for people to work 4 days. I think 3 and 4 is not uncommon. Some people, I think anywhere from 3 to 5 is common in derm. So if you get that set up, then that will work great too. And that can help you when you go to start doing your rotation. Because most students go PRN once they start doing their clinical rotation as an NP. I didn't because I worked at night and I was able to, and I had some seniority. It helps if by the time you go to school, you've worked somewhere and you're going to stay there during school because you can get more flexibility with your schedule. And so I was able to get the schedule I wanted for work to maintain full time hours and money and also go to school. And so just think about what's going to be, how much do you need to live? And then what's going to be the best place for you to work. So let's say you do your board, you go work at the hospital, and now you have those 4 days to play around with. Maybe you're getting education, maybe you're shadowing, maybe you get a second job. And then at some point you need to make that transition to derm. So if you don't start off there, add it on at some point as a nurse. It's going to be easier to get in. And then you'll just make yourself more competitive and be able to offer more comprehensive care once you've had that background. And it'll help you make your decision. Make sure you're really clear about it, that you're confident. And then if you decide you ever want to add on other things or transition to something else, maybe you end up moving and it's just not, there's no market for derm or the hours that they're offering don't fit your lifestyle anymore. At least you can say you have these other skills and you've had experience delivering them, utilizing them. Excuse me. So I think that's going to be my recommendation. I can't remember which video I watched where I talked about, I think multiple videos probably. But I think after thinking about the value nurses bring to a business owner, I think it's because of that rich background that we get. It doesn't have to be the hospital. It can be long-term care. They get quite a bit there, but the hospital in particular is where the sickest of our sickest go. And so if you can take care of people at that level, the stress, the education, the relationship building, the interdisciplinary care, seeing the different roles in healthcare, because you don't see that in other settings, you're not going to be privy to that, right? They might be in a completely different building in a completely different city. And even in the hospital, that still exists, the corporate structure, you might not be as exposed to it, but like I told you before, if you're in the hospital, you should be active in the hospital. If your hospital has like committees, if it's a magnet facility, teaching hospital, but even if it's not, just ask your manager, your nurse educator, if you can create something there that's derm focused. So you'll still get some exposure, and that will likely get you some exposure to leadership and other people in the entity to give you exposure. Not only you exposure, so they know you exist, but also just being able to see beyond the bedside, right? Which is super important. You need to see that you can do more than patient care. So you do that, you go to the hospital, you're working at the highest level. And you know what Dr. Farah said? She said, typically nurses who are in the ICU and ED tend to be your entrepreneurs. And I think there's a lot to say there. I can't argue with that, actually. I would love to see if there's any data to back that up. And, you know, I did start in the ICU myself. And back then, I mean, I didn't have any aspirations, like legit. I always had like ideas about business and what I wanted to do. But nothing like you see today. And so yeah, I was drawn to that setting. But people are drawn to that setting for a lot of reasons. Well, at least I think people are drawn to that setting for a lot of reasons. You know, there's some excitement there. There's this concept that you know, they're the best. You know, but you're gonna get those skills and all that stuff anywhere. It's really what you do with them. And then you just have to know yourself. Not everybody wants to be in the hospital. Maybe some people don't want to work 12-hour shifts. It doesn't work for their body. It doesn't work for their family. They want to be home picking up their kids. And so an outpatient clinic might be best for you. The hospital does have very, different hours too, because the hospital has outpatient clinics also. And so that might give you're in one company, one application, one interview. So maybe during the day you work, maybe during the day you work in one setting and you do PRN in the other setting. And that can give you different levels of experience there too. Yeah, so just play around with those ideas, depending where you live and what's accessible to you. But the key really is to start, my advice is to start as an RN in derm. And so the idea is thinking about if you're going to start there, or when you're going to make that transition. Now, technically, you could start at a clinic, derm clinic, and do your PRN at a hospital, right? You're not going to. The thing about the PRN gig is you have to think about like what's orientation, how much are you getting oriented to that setting, and how much are you going to really be able to build on that. I think if you do PRN, it works best if you have done it full time prior. Otherwise, I'd be concerned, and people can talk about it if this is their experience. I would just be concerned that you'd be doing a lot of too much teaching on your own in the beginning when you really need support. And you're more likely to have better relationships with people so you can get the support you need than when you're someone who just pops in and out. Those are my thoughts in terms of that. I would rather you do derm PRN in the beginning and then transition. And I think it's easier to get that derm job as an RN. However, if it's a challenge, then if you've worked PRN for a year or two, when you're ready to move into full time, they will have known you. You will have established that relationship. So yeah, I think that's it for today, guys. That's going to be a quick one. Let me just look at my notes, see if there's anything I forgot. And remind myself to put the link for Flowers Conference in the description box. Yeah. Yeah, and I think the key, regardless of where you are, is keep getting your education. So I already have an article on the Mahogany Dermatology blog on essential dermatology textbooks for skin of color. There's webinars every single week from so many different platforms. If you need help finding some, just let me know. And they're offering free education. So you can be learning all the time, hearing from people all the time. There's podcasts, there's conferences. Wherever you live, there might be a local chapter that's doing an event. Just keep getting that education, not just to make yourself competitive, but so that you can know what all the different ways you can contribute to the field as an entrepreneur, particularly. And just continue to work on being a key person of influence. You can't do that if you don't know what's going on. And you have to know what's going on outside of where you practice. I'm really big on that. So whether it's a hospital or outpatient clinic or school, right? Because that school is a bubble. All of those things, if all you do is you go here and then you go home, you go here, you go home, you go here, you go home, you only know what's happening right here. When you work on a unit, you're an expert in that unit. When you go to another unit, it's a different culture. You have to learn that culture and kind of start over based on that. Now, when you're new to something, there's a learning curve. But let's say you're an experienced person learning something. Once you reach that peak of learning this new thing and it catches up with your level of experience, you take off. When you're both new to the thing and new to practice, it's a little bit slow. It's a little bit slower, right? It's going to take a lot longer. So if you're experienced and you're coming in, you're a little bit hesitant, your confidence is a little bit frail, don't fret. In about 3 to 6 months, if you're you're working, you're educating yourself. In derm, maybe give yourself 12 months. But it won't take 12 months to see this, but you should see some evidence of growth. If you're intentional, that's going to catch up with your experience and you're just going to take off from there. And I think it's that's making the nurse so much more competitive, right? So I think that's my advice. I invite you to check out the virtual preceptor shop so you can see how to make that transition from bedside to dermatology. Register for the Diversity in Dermatology Conference. Meet me in person in Louisville. Join us in the DMB Dermatology and PPA group in Derm and Ps of Atlanta, another place to meet me in person or online. And every week on the Mahogany Dermatology blog, where I provide free resources to help you in your journey. And every Sunday here on YouTube, answering your questions directly. Shout out to my students. I think I had meant to talk about them. Maybe that was the thing at the top. I was like, I need to talk about something. So yeah, Allie, she did wonderful for her semester. Congratulations to her. She's looking forward to graduation in August from her first program. Then she'll transition to the MSN program. And then I met one of you who last time I talked to you, one of the most recent videos was how I met the National Black Nurse Practitioner Association. And one of the people in attendance is a DNP student. And so many of you share her experience But you go to your advisor, who's probably, their experience is primary care. You give your idea about doing something in derm, and they shoot it down, right? Because they're trying to help you avoid barriers, and they see that as a big barrier because of the lack of education and training that we get if you're not, in that already. And so she was really discouraged, and just chatting at the table was able to give her some ideas and a strategy. We hopped on a call. She came packed with a whole proposal. She has already reached out to settings. She thought about barriers. She had wonderful questions, really smart questions about how to address this. And what if I go back and my teacher says this? And I mean, just she's looked at the research. Like, she was really on it. I was super impressed. So I'm looking forward to hearing what her advisor says with this new proposal idea. And I'm just excited that it's right here. So it's there may be an opportunity for me to be present. So I'm super excited when she does the implementation, and just to see her face lighten up, right, brighten up. I recently put a video out on all the different ways you can specialize in dermatology, and just like being able to share that with her and with you, it just brings me so much joy, and it just gave her so much hope, right? Hope is huge, it's powerful. And then my DMP student at Hopkins, shout out to him and his family. He had a meeting with his clinical site, who did agree to let him do his project there. And yeah, so excited for him, and just excited to be part of education and research and bringing more access to that for everyone. I hope you have a wonderful day. I hope we have a wonderful week. Please let me know how I can best support you. I just thank you so much for watching. And I'll see you next. Oh, remember, new videos every Sunday, 12:15 midnight a.m. Thank you so much for watching. I'll see you next time.